Hi guys, welcome to my YouTube channel. My name is Neslalis and I'm back again today with another video for you guys. And today I'm talking about something else that's very important, and this is the second video of my pregnancy series actually. And today I'm talking about the importance of booking early in pregnancy. This is something that I really feel like it's so important, ladies. You really need to ensure that you do this as part of your planning for pregnancy. You need to think about when you're going to book at your nearest clinic or with a doctor for your pregnancy, because this is something that you really need to do and it might save you a lot of time and a lot of trouble. So if you want to know more about the importance of booking early in pregnancy, then you better stick around. And if you do enjoy this video, please give it a thumbs up, please like it, please share it, and please do not forget to click on the notification bell after subscribing to our channel, because I know you are going to subscribe. And yeah, so do click on the notification bell so that you can know when I am going to post the video. Actually, you'll be notified when I post a video, and I plan on posting a video quite frequently because I need you guys to know all of the good information. So yeah, that's what I'm here to do. So yeah, thank you so much to everyone who has supported me thus far, who has watched all of my videos. I'm really loving the support that I'm getting, and I want to thank you guys so much. So without any further ado, let's get right into this video. So what I will be talking about in this video when it comes to the importance of booking early in pregnancy, I will be answering 3 questions. The first question is, why should you book early in pregnancy? The second question is, when should you book early in pregnancy? And the third question is, how to do it. So let's get on to answering the first question, which is, why should you book early in pregnancy? To answer this question, let me first talk about the aims or the purpose of booking in pregnancy, and talk to you guys a bit on what it actually is to book pregnancy. So that first visit that you actually make to your local clinic or to your doctor when you are pregnant, that is called a booking visit. So if you go to a doctor, a sono will probably be done and some booking bloods will be taken, right? If you go to your nearest local clinic, where you will find me, we will take your history, we will do a physical exam, we will take booking bloods, and we will write all of this information on an antenatal card that you will be carrying throughout your pregnancy. So you will be registered as one of the people who are pregnant in the country, and you will have an antenatal card that you will take with you everywhere you go for the duration of your pregnancy, whether you're going to a private doctor, whether you're going to an obstetrician or the hospital. You will have that card that you'll be taking with you everywhere you go throughout your pregnancy. So what is the aim, or what is the purpose of actually attending antenatal care and booking your pregnancy? So antenatal care is actually something that is so important, because its purpose or its aim is for the early detection and management of chronic medical conditions and pregnancy related complications, right? So we want to ensure that if you are having any complications along the way, if you're having any chronic medical conditions that you perhaps did not know about before you were pregnant, we detect them early, we manage them so that they do not affect your pregnancy or the health of your baby or your health as a mom in a bad way. I spoke a lot about this in my first video on planning for pregnancy, that we want women to have successful pregnancies. The less stressful a pregnancy is, the more joyous it will be. So that's really what we want. That's what I want. I want to help all of the women who come to me to be able to help them with that. So when you book early in pregnancy, you are able to then help your health providers, help your nurses to be able to detect if you are having any chronic medical conditions or any conditions that you had before pregnancy but you didn't know that you had them, and if there are any new conditions that are now coming out in pregnancy or any complications that may be blooming, you are able to get them detected early because you're already in the healthcare system. So that is why it is so important for you to book early in pregnancy. You want any problems to be detected early, to be managed early, and if you need to be attending at a higher level of care like a hospital, you are referred as soon as possible. Some complications in pregnancy, actually, they show themselves quite early. Other people, you'll find that maybe a woman never had high blood pressure before she was pregnant, or she never knew that she had high blood pressure because she was not constantly checking. And then you'll find that now when she's pregnant and she presents herself to the clinic, then this blood pressure will be quite high, and it will be sort of difficult to determine whether it is chronic or it is pregnancy that is arising due to, that if it's blood pressure that is coming about due to the pregnancy. So yeah, it's very difficult to ascertain whether it is chronic or it is pregnancy related if a woman books late in her pregnancy. So that is another reason why it's very important to ensure that you book early when you are pregnant, so that we can get a baseline as health professionals or as the nurse that's going to be taking care of you. We can get a baseline of what your health was like while very early on in pregnancy, and then we can be able to notice any changes that do come about as you progress through the pregnancy. And then also in pregnancy, there are also other complications that take place quite early on in pregnancy, and actually some women will be having this sort of thing without even knowing that they are pregnant. For example, people usually have like your miscarriages at like your 2 months, your 3 months, and you'll find that the woman was having pregnancy symptoms, but she never booked, she never did a sauna, and then she now has this miscarriage. She didn't know for sure that she was pregnant, but she was having pregnancy symptoms and perhaps did a pregnancy test but never went to go and book. So it's very, very important that you are also booking early so that you can be given health education on some of the types of complications that occur in early pregnancy, so that if you do notice any of those complications taking place with you, or you're having any signs of any complications, then you know what to do and exactly where to go at the right time to prevent you losing your pregnancy, for example. Okay, so let's answer the second question, which is how should a woman book her pregnancy? So as I said, there's 2 options. You can either go to your nearest local clinic and you will be coming across me and then I will help the women that I meet, obviously, to book their pregnancies and start antenatal care. So that's the first option, and at your local clinic, bloods will be taken, a physical exam will be done, and your history will be taken to assess whether you're high risk or low risk. Do you qualify to attend your antenatal care at the clinic, or do you need to be referred to a higher level of care, which is a hospital, because you're high risk depending on whatever chronic conditions that you have, or any pregnancy related complications that you had in your previous pregnancies. So that will be done on your booking visit. It's a visit that takes quite some time because a lot of information needs to be taken from you, obtained from you. There's a physical exam which we need to do. So it's really just a lot. Bloods need to be taken, baseline bloods, which are called booking bloods. And so one of the bloods that we take in at your booking visit is RH. It's a blood type. Most people are RH positive, but you will find that there are some people who are RH negative. Males and females can be RH positive. And then you'll find that maybe a woman is RH negative, and in her subsequent pregnancies, there's a chance that if the baby is RH positive, possibly taking that RH positive from the father's side and the mother is RH negative, and if there's any mixing of the mom and the baby's blood, the mom's blood can form antibodies against the baby's blood to attack the baby's blood, which can cause jaundice in the newborn. So we take that RH blood to know that kind of information when the woman comes to book. And then another booking blood that we take is we take bloods to test for syphilis, which is an STI that can be passed on to the baby and that can cause complications in the pregnancy. And we also take blood to check for a woman's hemoglobin. In simple terms, that gives us an idea of how much red blood cells the woman has, or how much oxygen is being carried in the red blood cells. If the hemoglobin is low, it means that the woman has anemia and she might need to take supplements to increase her red blood cells. If a woman goes and books at a private doctor or at a gynae, they will probably, in some practices I've seen that they do write cards for them, take the history, do the physical exam, and then they also take bloods. And then you will find that with some doctors or some obstetricians, they will do a sonar for the woman. So to answer the second question, which is when should a woman book for pregnancy or register their pregnancy? As early as you find out that you're pregnant. So as early as your first or second missed period. As soon as you're having some symptoms, you don't feel like yourself, and you think that you may be pregnant, take a pregnancy test. And what you can do is that if you are unsure of your dates of your last normal period, possibly because you're already having irregular periods before you were pregnant, or you are on a contraceptive that messed up your menstrual cycle and now you are not sure when you actually conceived, it would be great for you to actually go and do a sonar to determine how far pregnant you are before you go to your local clinic. Then you go with that sonar, and then it will be easy to determine how far you are already, and your nurse and midwife can then take over, write an antenatal card for you, and take it from there. And it's important that if you're going to do the sonar, you need to do it as early as possible, especially for determining how far pregnant you are. It's advised that you need to do it when you are less than 20 or 24 weeks. And then other things that they will do when they are doing the sonar for you, they will check where is the pregnancy located. Is it inside the womb? Because sometimes it can be outside the wombs, like in your fallopian tubes, and you find that the woman is having an ectopic pregnancy. So they'll check the position of the pregnancy. They will check your baby's heartbeat to confirm the heartbeat, confirm your gestational age, how far pregnant you are. They will confirm whether you're carrying a single fetus or multiple fetuses in multiple pregnancy. They will check for any abnormalities in your pelvic region, like any fibroids or tumors or cysts that could have been there before you fell pregnant. So those are the things that your doctor will be checking when they are doing a sonar for you, especially in the first trimester. If you are in the second trimester, they will be checking things like the placenta, the position of the placenta, especially if you've had a cesarean section before. You do need to have a sonar done to know the position of the placenta, because sometimes in some women you'll find that the placenta will try and find another place to put itself when in early pregnancy, because the woman has that cesarean section scar, and then instead of placing itself maybe at the top of the uterus or at the back posterior position, you'll find that it will be very close to the cervix or low lying, which we call placenta previa, and that can cause a woman to be bleeding throughout her pregnancy. So they will be checking for the position of the placenta. And then something else that can be done in the second trimester, especially after 20 weeks or 5 months of pregnancy, they will also check for you the gender of the baby. So it's very important that you do a sonar as well when you're still early pregnant. And then another complication that can arise or happen to a woman in early pregnancy is hyperemesis gravidarum. So most women, they will have your morning sickness when they are early pregnant, especially in the first 3 months. So they'll be having your nausea, your vomiting, especially in the mornings. But you'll find that some women, they're having this excessive nausea and vomiting, which causes them to not be able to eat anything at all, and not only during the mornings but throughout the whole day. You find that everything that they eat, they will throw up. So that is not good, because it will deplete the woman's energy and hydration status, and then the woman's body is going to start going to starvation mode, whereby the body is trying to look for energy, and it will start breaking down fats in the body. So that's really not a good state, because the woman needs energy, the baby needs energy. So definitely a woman needs to ensure that if they do start having this condition, they do get the help that they need immediately. So most of these kind of things, especially like your danger signs or things that are complications in early pregnancy, when you go to your nearest clinic to book, you will be told about the danger signs in pregnancy. So things like having lower abdominal pain and bleeding, those are sort of the things that you will be feeling if you are having a miscarriage, or if you are having a threatening miscarriage, which hasn't happened yet but might happen later on. So things like that, low abdominal pain, that's like period pains, bleeding from your vagina, you will be told about those kind of things to look out for. Excessive vomiting, feeling dizzy, you will be told that if you have any of those things, you go straight to your hospital. And then other danger signs that you will be told about that might happen later on in your pregnancy, it's things like persistent headaches, maybe due to your blood pressure being very high, decreased or absent fetal movements when the baby stops moving, or the baby's movements decrease. That's also a danger sign, and you need to seek help very early on. Another danger sign is if you are having low abdominal pain, you could be in preterm labor. If it happens you are more than 5 months pregnant, you could be in preterm labor. So all of this information you will be told about when you go for your booking visit, and you will be told that if you are having any of these symptoms, they're a sign that something might be going wrong with your pregnancy or with the baby, and you need to report to your nearest hospital. So if you're having danger signs, you report to your nearest hospital, not clinic, because danger sign is an emergency and you need to seek emergency medical help as soon as possible. So yeah, it's really important, ladies, to book early. You will learn so much about your pregnancy, this journey that you are starting, and even your mind, you'll be mentally prepared on the whole journey if you book early in pregnancy. So I urge all of you to ensure that you do book early. You really just want to make your pregnancy a pleasant one. And if there are any things that are arising, any new diagnoses, if you have high blood pressure, you need to make sure that you are referred to the next level of care. If you have things like a diabetes and you're very anemic with a very low HB, you need to be sent to the hospital to ensure that you get all the investigations and the tests and the management that will help you to have greater chances of carrying out your pregnancy through as successfully as possible. And if there are new conditions that are arising, things like HIV or even hypertension in pregnancy or diabetes in pregnancy, you want to know that you will be started on the relevant treatment as soon as possible to prevent any effect to your baby. So yeah, that's all I want to talk about in this video. I really want to encourage all of you, as soon as you get that pregnancy test positive, as soon as you start showing those signs of pregnancy, as soon as you miss that period, make sure you do go to your nearest clinic and book your pregnancy, or go to a doctor or a gynae, do a Sona, and you can take that Sona with you to your nearest clinic to book with. Mwah. Thank you guys so much for watching this video, and if you liked it, if you feel like you learned a lot from this video, please do give it a thumbs up. Please subscribe to my channel, hit your notification bell, and share this video. Until next time guys, thank you so much for watching. I love you all so much. Bye.